Welcome to the Tower Talk podcast, a place for honest and open conversations to support you in living your best life from the inside out. Join me on this journey of self-discovery as we explore what it means to reach next level badassery and cut through the BS. So tune in, stay a while, and I promise I'll be right here alongside you as we figure this shit out together.
Welcome to the show, Dr. Amy Osborne. She has her doctorate in physical therapy and has found her true passion in pelvic health. I am so excited to talk all about pelvic floor dysfunction, pain management, and how she handles the community that needs pelvic floor therapy the most. I also love when guests introduce themselves because you know you best. So, Amy, thanks for being here. Give us a little elevator pitch on who Amy Osborne is.
All right. Yeah. Thanks so much for having me. As you mentioned, I'm a pelvic floor physical therapist. So I think a lot of people hear that and they're like, well, what exactly does that mean? All physical therapists go through the same schooling, right? You go through, nowadays, it's a 3-year doctoral physical therapy program. That's pretty much standard in the US. And then a lot of pelvic PTs go on to do continuing education to actually specifically deep dive into how the pelvic floor works. But any good pelvic PT should be a really good foundational physical therapist as well. So if somebody's got something going on with their pelvic floor, your pelvic PT should be able to look at your back, your hips, your feet, kind of have an idea of what's going on. And my actual background, I guess, the whole reason I became a physical therapist was that I was a personal trainer and a group fitness instructor first. And so I kind of always thought that I would do something more. And I found my way into PT school, not thinking I was going to specialize in the pelvic floor. But as with most things in life, I don't like the standard way that things are done. And I was like, I just can't be a regular physical therapist. So pretty quickly into my journey, I was like, I better deep dive into something that's really niche and an underserved population. And at the time, we used to call it women's health physical therapy, but we've now kind of changed that nomenclature, mostly because every person has a pelvic floor. So, because of that, every person can have pelvic floor dysfunction. So yeah, that's who I am. That's what I do. I work out of Denver.
Amazing. Yeah. I want to tell you also, Amy, that Amy and I have had a relationship for a while. I was in Denver for a long time. And honestly, I reach out to Amy anytime I ever have any pelvic floor thoughts or questions at all. But I will tell you, I went to a pelvic floor therapist for the first time just a few months ago and thought of you. And I was like, I learned so much in that one session about me and my own pelvic floor that I was like, people need to know about this. So why do people need to know about this? And can you give just kind of an understanding from both perspective, male and female, of why do we need to know about the pelvic floor and what is its purpose?
Yeah, I think everybody needs to know about it because everybody has a pelvic floor, first and foremost. But secondly, everybody uses their pelvic floor every day. So we pee, we poop. Maybe we don't have sex every day, but we hopefully are having sex with some frequency. We need our pelvic floor muscles for that. And if you're up walking around, guess what? Your pelvic floor also plays a huge role in helping to support your body and to stabilize it. So to give you just a little bit of an introduction, if we can kind of visualize what the pelvic floor is and where it sits, if you put your hands on your hips, that's your pelvis, right? And at the base of your pelvis, kind of from your pubic bone all the way back to your tailbone and out to the sides of your sit bones where you're sitting is sort of this cradle of muscle, and that's your pelvic floor. It's kind of, I like to think of it almost like a basket. So it's, kind of concave towards the floor. And it's holding up your organs right now. So if you have a uterus, your uterus is sitting in there. And then for everybody else, we've got bladder and bowel in there. And because of that, there's a little bit of weight there. And that muscle tissue actually is what's holding those organs kind of inside our body. If you think about it, it's kind of crazy. It's not like there are bones holding those organs inside of you right now, kind of, like your skull holds your brain in, but we have muscles that literally have to hold those organs in all the time. And those muscles really respond to the pressures above them. So if you were to brace or bear down, you're going to have a change in pressure in your abdomen, and your pelvic floor muscles are basically responsible for responding to that. And then, pelvic floor also is going to hopefully, and all of us as we're sitting here right now, do what it's supposed to do, which is make sure that we're not peeing or pooping involuntarily, right? That's hopefully what's going on. Sometimes that doesn't happen, but that's, there's a lot of areas where the pelvic floor can become dysfunctional. And so then we will see things like urinary changes, bowel changes, and that could be either leakage or having a hard time getting things out. Sometimes people that have been chronically constipated are surprised to learn that, oh my gosh, my pelvic floor has been tight this whole time. Maybe that's why I'm having a hard time getting bowel movements out. Or people with sexual dysfunction may report pain with penetration or difficulty actually even like achieving an orgasm. And then of course we can see people that have pain. That's like the big thing that I see a lot of, is people that have pain in that area. And I think that gets dismissed a lot, especially in a younger population. I think in a younger female population in particular, I'll see so many young women go to the doctor and they'll say, oh, I think I've got a UTI or a bladder infection. And they run every test and nope, you don't have a bladder infection, but we're going to put you on antibiotics anyways. And then that doesn't really do anything. But lo and behold, the whole time the problem was their pelvic floor muscles. So just there's a lot that can go awry in that area, obviously outside of childbirth.
Yeah. Yeah. How do you know? I mean, like, when you go to the GP and you're like getting all these and you get on antibiotics and you're like, well, how do you ever figure out? And what are some clues like people could take themselves?
Yeah. I think when it comes to that specific instance of like, you think you might have a UTI, okay, so let's like paint the picture. If you have an actual bladder infection, have you ever had a bladder infection?
No.
Okay, good. So let's keep it that way.
Yeah.
They're miserable. They're terrible. I mean, you feel like crap. You typically have a fever, you have backaches, you feel ill. And with that, you sometimes have this like intense urge to pee all the time. And then it really hurts when you pee and it feels like you can never fully get your bladder empty. Well, if you take out the sort of like feeling crummy, the feverishness, the kind of like feeling sick part, if you're only really having this urge to pee all the time, chances are that's your pelvic floor muscles. And then moreover, if you go to a doctor, I always encourage, go to the doctor, like rule it out, make sure that you don't have an infection, because we want, an untreated infection could be a bad thing. But if it's not culturing positive and antibiotics aren't working, that could be a sign that your pelvic floor is dysfunctional. Now, typically we also see other things and people will be like, oh, I didn't even realize that could be a contributor. So like I mentioned, maybe you're that person that says, wow, I've always had a hard time getting bowel movements out, like, or I have hemorrhoids all the time. Or if you maybe have pain with penetrative intercourse, or you have pain if you use tampons. Or what would be another really great example? I mean, even just like pain that in your lower abdomen that like you just have never been able to fully explain. Yeah, those are kind of some of the big signs. And you know your body, right? If something doesn't feel right, chances are something's not right.
Go get it checked out. But in that same instance, I wonder too, like I when I went to this physical pelvic floor therapist, you have to get some sort of referral, right? There's like with any sort of like I went to see an ear, nose, and throat, or like something with my hand, or like a mouth thing or whatever. You always have to get these like referrals. And I'm someone that just doesn't have a general practitioner. And a lot of what I'm hearing is the doctors may not even know that it is the pelvic floor, so they may misdiagnose it in some capacity. So do you feel like there's any other things that people could kind of skip some of those steps or some of this pain for so long to do?
Yeah, great question. And, it's a shame because in some states, like here in Colorado, it's a direct access state. So you could go see a specialist. It always has to do with like your state's scope or like their practice acts and sort of like jurisdiction over how insurance works. So insurance aside, because that's a whole nother topic of conversation, you can always look up like pretty quick Google search, am I in a direct access state? If you are, great news, you don't need a referral. You can typically pop in and make an appointment with anybody. If you're not in a direct access state, in your case, I think that hopefully practitioners and medical providers in general are like becoming a little bit more open to your suggestions. Many times, like a pelvic floor physical therapist would be glad to jump on a phone with you and say, hey, listen, I've got a relationship with this doctor. I'm going to send you there and they can help get the ball rolling. So if you always look at like your end result and talk to that person first, they want to help you. So they're going to be able to help you go through the steps that you need in order to get there, if that makes sense.
Yeah, I will tell you, I paid a chiropractor $60 to do a fake telehealth pretty much appointment to get into this physical or pelvic floor therapist, which is like, so like, it's, that's probably a whole different conversation, but it's just such a roundabout way to get to like the actual source. And I didn't even know that that's how it was in Colorado. I was like, oh, I have like really good health insurance with Teddy's job now. I might as well use it with what I can. And then I'm like, well, I gotta like go these like roundabout ways to get the help I need.
Yeah, it is frustrating because, insurance can be such a blessing and a curse for so many people.
True.
I once worked somewhere where we had like accepted insurance, but we were billing through the hospital. So people would
Okay.
be like, oh, cool, you take my insurance. And I'd be like, yeah, but we're going to bill your insurance like $700. So if you have like if your insurance only covers 30%, you're going to be on the hook for a very big payment. So I always tell
Yeah.
people too, if you are going to use insurance, just call somebody at your company and be like, explain to me, what will this cost? You can
Yeah.
always talk to the person that you're scheduling with too and be like, can you give me an EOB, which is like an estimated benefit, basically? Like, what is it going to cost me to come see you?
Yeah.
Any good provider should be able to do that. I always tell people that, like, don't hesitate
Okay.
to ask people so that there's no upfront or there's no like, scary prices on the other side of things or
Right.
unexpected charges. Cause that's another piece of the whole medical
Yeah.
system. That's a mess.
Well, that's the next point I was going to get into, because I feel like a lot of people want to know and want to like understand the education behind pelvic floor, but also like know themselves, but maybe they don't have the accessibility to get to a therapist, or it's just like unaffordable to them. So like, is there something that they could do themselves to kind of figure some things out on their own?
Yeah, definitely. I mean, I think that now the internet and social media is like such a great resource for people to get some very basic understanding. I mean, even in the time that I've been practicing, I think I had opened my first Instagram account after I started practicing, which is crazy to think about that, like looking over 12 years ago, probably.
Yeah.
And nobody was posting on Instagram about health related stuff back then. So
Yeah.
in that time that I've been practicing, it's just remarkable how much more people even have the awareness of what pelvic floor physical therapy is. Now a lot of, if a woman becomes pregnant, like they're going to know, I need to probably see a pelvic PT. 5-10 years ago, that wasn't the case. It was like, oh, you have a horrendous tear, or they have to use a vacuum to help you deliver this baby.
Yeah.
Now you get to go to pelvic PT, and it's like very much more reactive as opposed to proactive.
Yeah.
So in circling back to your original question, what can people do? I mean, a simple Google search, obviously, at least give you some really good insight in terms of how does the pelvic floor work? How do I identify if I have a tight pelvic floor versus a weak pelvic floor? And I think that there are a lot of really great resources. I love the Bloom method for moms. That's a company that does a lot of like educational exercise stuff for really new moms. And I'm sure that there are plenty of people out there that are doing similar things. But the other thing that I tell everybody is look at the APTA website, the American Physical Therapy Association website, because if anybody's a member, you can find, there's like links to find a pelvic PT. Sometimes there are filters where it'll be like, do you take Medicaid? Do you take insurance? So at least it's a little bit more accessible to finding somebody.
Okay.
Similarly, there's another website, another organization called Herman and Wallace, and they are a great resource for people to find a provider. And then the Pelvic Guru is another great place that a lot of like professionals like myself have joined just so that people can find us. The other piece of all this is that now we have telehealth. I think that's something that came from COVID, right? Is that like we have this amazing ability to like interface with people and be able to help people from afar. So if you don't live near a pelvic health PT, you might be able to easily connect with one using a telehealth sort of service. And if it's more of like a cost prohibitive thing for you, 95% of physical therapists are like the most heart-centered people on the planet. And they do what they do because they love helping people, myself included. If somebody were to reach out to me and say, I don't have any money, I need to know what's going on, I would find a way to help that person. So, I think it's not like trying to take advantage of that in PTs, but no physical therapist goes into this field to get rich. So, reaching out and just saying like, how can you work with me? There will undoubtedly be somebody that would be happy to at least point you in the direction of somebody that can help you.
I love that. And I will make sure to put all of those links that Amy just talked about in the show notes as well, so you can find a pelvic floor therapist near you. So I'd love to go into this next little segment of, is it normal
Oh
And
yeah.
I love like some of the questions that people, send in, even myself. I'm like, is this a normal thing? Is this? And so I'd love to just you say yes or no, and then kind of maybe just explain why it is or
Sure.
it isn't, and what we can kind of do from it. So I'm going to say, just from personal experience, just because as of the past couple of years, I was like, why do when I lift like really really heavy, I'm like, oh my god, I just peed a little, or if I'm jumping on a box, I'm like, oh gosh, like why did some pee come out? I realized that it's not, but let me hear you. Like, how does it? What is happening, and is it normal when that happens?
Hmm. Hmm. Um, we're going to say that leakage is never normal. Common, yes. Normal, no. It's a
Okay.
sign that that muscle is failing in some capacity. So one of two things could be going on. Ultimately, we know that the muscle is not really responding appropriately to the pressure put above it. So in the case of a really heavy lift, we're thinking about really increasing the pressure in our abdomen, right? So whether you've got a belt on or you're bearing down, we deadlift in a gravity dependent position, right? Nobody's deadlifting like laying down. So pressure is going to travel downward towards your pelvic floor. And in those instances, that pressure is literally coming down on top of your bladder and probably making your bladder potentially move a little bit so that those sphincters are leaking. Or that pressure is just so much that it is actually kind of overpowering those sphincters and getting a little bit of urine to come out. So with the case of like a box jump or jumping rope, it's more like almost an endurance piece, right? So I like to think about the pelvic floor again, kind of like a basket. And bear with me, this is a silly analogy. Imagine, Tara, that you and I like held on to a piece of cardboard. You were on one end of the piece of the cardboard and I was on the other end. And somebody set a baseball on top of that cardboard. And we tried to like toss the cardboard or toss the ball up in the air while hanging onto the cardboard and then tried to catch that baseball. Well, it would be like hard. That ball would like maybe crack the cardboard, it would roll off. Whereas if we did that with like a piece of fabric, the fabric would cradle that baseball. And the difference between the cardboard and the fabric is that the fabric has elasticity to it. It can lengthen. Many times when I see somebody that's having stress incontinence with jumping, leaking, that sort of thing, it's not that their pelvic floor is weak per se, it's that it can't lengthen with control. So think
Mm,
about like a step up. The step down can often be the more challenging part of a step up if
right.
done correctly, right? It's that eccentric portion, that lowering with control. And I think that's where we can also see like somebody doing a traditional back squat. If somebody's just like dropping their ass to the grass and not controlling the descent of that squat, it's like you've just missed out on a huge piece of your strength training regimen. And the pelvic floor is no different, right? Because when we think about pelvic floor, we're like, oh, tighten it up, tighten it up, tighten it
Yeah.
up. And we're not
Yeah.
really ever practicing like, oh, how do we actually get it to not relax? Because you're not relaxing when you step down in a box jump, or excuse me, a box step up, you're eccentrically lowering, you're lowering with control. And I think that that's a huge piece that nobody ever really touches on with the pelvic floor in particular. So
Yeah.
while it seems like, oh my gosh, this is because my pelvic floor is weak or it's not doing what it's supposed to do. Sure, it's not doing what it's supposed to do, but it may not be because it's weak. It may be because you don't have the ability to let it lengthen with control.
I'm so glad you bring that up, because that's exactly what the PT said to me. She's like, you're just so tight. Everything's just so tight, and you're really good at tightening or like, engaging, but it's really hard. And I was
Mhm.
like, I'm focusing so hard. Nothing's happening. Like I can't do it. And it's like taking me so much time to like really be able to just like relax, like you said.
Uh-huh. And,
Yeah.
I think a huge cue that I give people, especially in, if you're doing other movements, you can start to tune into what your pelvic floor is doing with those movements. So we don't need to be thinking like, oh, I'm going to Kegel as I jump rope. And in fact, if you try to hold a Kegel with a deadlift,
Yeah.
good luck.
Yeah.
Like that's not going to work well for you. Same thing. Good luck trying to hold a Kegel as you box jump. We want to think like as we come into hip flexion. So meaning like as we're lowering down in an RDL or as we're lowering down into our squat, can we make that connection of like, oh, my pelvic floor is not relaxing, but lengthening with control?
Mm.
That's like a challenge that I love to give people. Is like, okay, can I feel it like lengthen with control?
This is a perfect one, you guys, to do the next time you do a step up. Or actually, honestly, you can do it on your stairs as you're going up and down the stairs or something. You can like practice it right now. Okay, next one. Is it normal for sex to feel uncomfortable in some capacity?
This is like a nuanced answer, only
Okay.
if you want it to. So if it's like intentional discomfort because of whatever
Yeah.
you're going for, fine. So I don't want to like place judgment on like sex should not be painful unless you want it to be and you
Okay.
are
Yeah.
having somebody inflict pain on you, which
Got
do
it.
your thing.
Yeah.
It should not be uncomfortable. That being said, like penetration should never be like, oh, that doesn't feel right. Can be a variety of different things going on. So talking obviously about like more penetrative type on the penetrative side of things. If something feels, sometimes people will say it feels really raw or it feels like something is tearing. And then they go to the bathroom afterwards and like, okay, well, it's not bleeding, like nothing's tearing. What's going
Yeah.
on? Well, we have so many nerves in that area. And when that muscle tissue is really tight, it's going to deprive those nerves from getting the blood and the nutrients that they need. And nerves love blood flow. When they don't have blood flow, they get confused and their messages can become a little bit more skewed. So if we've got this sort of like pissed off nerve tissue because it's not being perfused with a lot of blood, something like pressure can be perceived as like, wow, that feels really scratchy or burny or even like tearing. And more often than not, that's due to pelvic floor tightness. So that's more the penetrative side of things. From an orgasm side of things, sometimes people can experience pain with orgasm because in order to achieve orgasm, our muscles do have to contract. So many times people will say like, oh, I can't quite achieve orgasm and it's quite painful. Think about like a bicep. If it was fully contracted and I said contract it even more, like that wouldn't feel good and you wouldn't even be able to generate any more force and it might actually even cause discomfort. And then similarly, some people can report pain with arousal. So female anatomy, the clitoris is actually quite similar to a penis. It has erectile tissue. Blood gets pumped up into the clitoris, and basically the muscle tissue should entrap that blood in that tissue to make it erect. Well, if blood can't get in there, sometimes people will be like, oh, getting aroused feels like pressure and throbbing. It's like, oh, well, that muscle's already too tight and I won't even let that blood that's trying to get in there get in. Or imagine like a big hose trying, if you like clamped down on that hose, you could see how that could like feel like a pressury type sensation. Mm-hmm. And that can be true for men too. So with males, we can see they'll report pain with erection, or maybe they can't even achieve full erection. And that's more often than not a result of more pelvic floor tightness. So in answer to your question, no, that's kind of why the reason sex could be painful and shouldn't be.
Got it. Yeah. Gosh, that was so helpful. Okay. Is it normal to pee in the shower?
What's up, talkers? I'm not sure if that's our nickname yet. I'm working on it, so we're just going to go with it. Sorry for interrupting this episode, but I am here to talk about our sponsor for today's episode. Let's talk about supplements. What do you guys like to use? I love Legion Athletics. Give me that vanilla whey protein in a shake, in my overnight oats. Heck, I might even just dry scoop it. That's how much I love it. The texture, the taste, the quality, it's top notch. Not only does it taste great, but they're backed by science. From their protein powders to pre-workouts, they've got the formula down. It's like they've cracked the code for better workouts and recovery. They deliver the highest quality supplements because they have a team of doctors, dietitians, nutritionists, and other clinicians making sure all the supplements go through rigorous third-party testing. So you know what you put in your body is safe. I may be biased because this is the only brand I've been using for years, but I think you should give it a shot. So if I've changed your mind and you're a little curious, head on over to legionathletics.com. Use code TerraTalk to get 20% off your next order. See what fits your vibe. No pressure from me. I'm just saying this could be the upgrade your fitness routine needs. Now back to more Tara.
Ooh,
yeah, I know this is you.
I know
this is like
mine because
you have a couple.
I think it's personal for me because I can't hold it back. And if my husband listens to this, he's going to not want to shower in our shower anymore because I think he holds me to a higher standard than that. But no, it's not normal. Here's the deal. If you want to pee in the shower, cool, but like you got to be in control of it. You know what I mean? Yeah. Like it can't be like, oh, crap, I can't hold on to this anymore. If you're like, I'm in here and I'm warm and I don't want to get out. Yeah, pee then. Here's the deal. The way that the bladder works is that essentially, even as we sit here right now, our bladder has some sort of urine in it. And it's constantly sending signals up to our brain. And our brain basically has to ascertain, like, is it time to go? Is it an opportune time to go? And like, is there enough in there that we really have to go? And I'm assuming that, as we're sitting here, the answer to that question is no. So our brain is sending a signal down to our pelvic floor muscles and telling our pelvic floor muscles to basically communicate with the bladder and tell the bladder, like, be quiet. We don't have to go to the bathroom. Mm-hmm. Well, that sort of signaling pathway can get really interrupted when anything that we've done as adults to like potty train ourselves kind of becomes abnormal. So for instance, I could go pee right now and then drive 5 minutes home. The second I put my key in the door, I'm like, oh my God, I got to go pee. I got to go pee so bad. It's like, no, you don't. You peed 5 minutes ago. And that's purely because now my brain is associating you are home with the stimulus of like, we're not going to suppress the bladder anymore. So the brain is always talking to us and telling that bladder subconsciously, like, not the time. It's not the time to go right now. So we see so often that like a lot of people in their behavioral day-to-day stuff have developed these really weird bladder habits. When I was doing CrossFit all the time, it was like I had to pee before every WOD. I could like pee before the workout and lift and not drink any water. And then it would come time for like the Metcon at the end and I had to go pee. It's like, no, you do not have to go pee. Yeah. Your brain is now like playing this just in case thing. And your brain's not telling your bladder to pipe down. The same thing goes for some people, when they hear running water, or they get in the shower. So it's like, if it's a habitual thing, the problem is that any habit that we lean into is going to get stronger and stronger and stronger, and therefore harder to break. So unfortunately, like those people that pee in this, like can't suppress the urge to pee in the shower. Well, if you let that habit go unchecked, could potentially end up being a problem 3 years down the road when you're like, oh my God, I'm driving home and I've got to pee. And now you can't suppress that urge anymore. Does that make sense?
Yeah. I mean, it's the same thing I would say as like, you're leaving and you're like, well, I don't know when the next time I'm going to go to the bathroom again. And you just peed and you're like, I got to go now again, like just in case. Yeah. And so like what you're saying is, in the grand scheme, like if we can't suppress it now, it's going to be so much harder later. And maybe some of that incontinence can come up.
Big time. Yeah. So there is a type of incontinence called urge incontinence. So we often think of like, incontinence as being stress incontinence. That's the leaking with, say, lifting or box jumping or coughing or something like that. We can also see urge incontinence where people get the urge to go and then like, oh my God, the bladder is contracting and I'm leaking right now. So that is a whole different type of incontinence that can come when we're really not good about suppressing the urge, or like you said, just in case peeing. As kind of like a PSA, if you're drinking like a pretty appropriate amount of water, meaning like, I'm not, slugging down 36 ounces in one sitting. If I'm drinking like, say, 16 ounces of water every hour, I should be able to go 3 hours between pees.
Okay.
But if you like drink a huge amount of water, in one sitting, you might have to go more quickly. So it's all kind of about like that mindfulness of how much have I had to drink? Do I really have to go? And kind of actually getting in tune with what your body needs.
Okay, this could be a sub question or separate maybe. Is it normal to, when you're sitting down to go to the bathroom, kind of have to push a little?
No, not normal. So in a perfect world, what happens? We've already talked about the brain tells the bladder to stop peeing. When we make the conscious decision, I'm going to go pee, things that start to happen is that the bladder itself starts to contract. So the bladder is a muscle. It's a different type of muscle. So it's not like our biceps, like our pelvic floor is. It's a smooth muscle. We don't have any control over it. The bladder starts to contract. We go to the bathroom. We sit down. In a perfect world, that bladder contracts and the pelvic floor muscles relax. So there's no active act in peeing. It's that bladder kind of contracting, and we're not doing that intentionally, and the pelvic floor is getting out of the way. So many times though, people will, we're in a hurry. We can be like, oh, I'll just pee as fast as I can or as hard as I can. And you're going to pee faster if you push. Not necessary, not helpful.
Got it. Love it. Okay. You are good. These are great. I've got one more. Is it normal to not be able to do a Kegel or not know how to do a Kegel?
I'm going to say that's very common.
Okay.
very common. Many times I'll say this, a lot of people assume they must be weak if they can't feel themselves do a Kegel. That may not be the case. It could either be that one, you're doing it incorrectly, or two, you're so tight. Think about that bicep. Like if you guys squeeze your biceps listening to this right now, bend your elbow. And then I say, do a bicep curl. You're like, I don't think I can, because you're already there. So that can be a case for a lot of people that I don't know if I'm doing a Kegel. It's like, well, maybe you're holding your pelvic floor tight right now. So yeah, you're not going to be able to do a Kegel. The other thing that I'll see people do is I'll see people actually bear down and strain. So the way to know if you're doing a Kegel correctly, if you have female anatomy and a vaginal canal, is to put a finger in your vagina and see if you can kind of generate a pulling up and in sensation. So you should feel tissue tighten around your finger and pull up and in. That is a Kegel. It should not feel like you are holding your breath, like you're straining, like your belly is pushing out. Like if you were to do it any harder, it would make you fart. That is not a Kegel.
Got it.
So I think that if you don't know if you're doing a Kegel, that's a great reason to see a pelvic PT, even once. Just get the feedback of like, hey, you know what? Maybe you don't know how to do this. So here are some strategies that can be helpful for you.
You do the Kegel with her fingers just in there. She tells you, she's like, okay, do it again. I'm like, okay, you're still in there. Let's do it again. But yeah, it is honestly, it's so nice to have like just feedback on like knowing what you're doing if what you're doing is correct or not.
Mm-hmm. Mm-hmm.
What is the reason why we do those?
Yeah, great question. I think that more often than not, unless you're having specific symptoms, I don't like people to do Kegels.
Okay.
So our pelvic floor muscle tissue is kind of automatic in nature. It's one of the only muscles in our body, and I'm going to get a little sciencey here, that has innervation from the somatic side of our nervous system. So the somatics mean like it's talking to our biceps. If we do a squat, our somatic nervous system is what's generating that squat response. If I tell you to flex your biceps, that's somatic. So we can have somatic innervation, meaning we can do a Kegel voluntarily. We also have autonomic innervation of our bladder. So when we think autonomic nervous system, we think fight or flight, rest and digest, so sympathetic and parasympathetic nervous systems, respectively. The autonomic nervous system also innervates the pelvic floor. This is why we can sit here and not have to think about like, oh, you know what? Hopefully when things are working the way they're supposed to, I drink a lot of water and I get the urge to pee and I don't have to think about holding it. It just happens. Or I cough and it just does what it's supposed to do. So I really like to think about the pelvic floor as kind of like a backup singer in a choir. Like it's never going to be the front runner for anything. But guess what? The pelvic floor works all the time. So if you're somebody that's not having any symptoms, there's really not a huge need to be isolating that specific muscle. It means it's probably doing what it's supposed to do. So when you do a squat, as you lower down in your squat, your pelvic floor should be lengthening. As you rise out of that squat, your pelvic floor probably does contract a little bit. So, but I don't think that people are thinking, oh, I'm at the bottom of my squat, time to do a Kegel to get myself out of this. Right. We know that like when your glutes are firing and you're coming into hip extension, your pelvic floors should naturally contract a little bit. So that's like the beauty of the pelvic floor, is that it's a little bit anticipatory in nature. One of the best things we can do for it is strength train. And to be really, really intentional with how we're breathing while we strength train. I think more often than not, I work with people who are like, oh man, I think there's something really wrong with my pelvic floor. And it's like, no, girl, you're weak. Your glutes are weak. That's like literally it. Your pelvic floor might be a little tiny bit weak, but it might not be turning on or it might be turning on too much because your glutes aren't doing what they're supposed to do. So it's a pretty interesting thing that I think that more often than not, Kegels aren't the answer. For somebody that maybe is having some leakage, they may be the answer, but I always say, don't assume Kegels are the right thing for you. Never jump the gun.
So interesting.
I think a lot of people will falsely assume, my pelvic floor must be weak. So I'm going to do 500 Kegels a day. One, don't. Just don't. That volume, it's a very small muscle, right? Like we would never do 500 squats if we hadn't been working out.
Very true. I wouldn't do 500 squats anyway, Amy.
Anyway. But, I think that a lot of people will often, I don't know, the old adage was to do them at a stoplight, right? Like
Yeah.
Quick. And that's just not a productive way of contracting any muscle. Typically,
Yeah.
we want to think, if you do want to practice doing some Kegels, connect it to your breath. Can you make sure that you can exhale and feel that your exhale helps you generate a contraction? And then equally as important, can you feel your pelvic floor relax as you inhale?
Yeah.
Can you feel that as your belly softens, so too does your pelvic floor? And making that sort of more neuromuscular connection and getting that control is so much more beneficial than doing Kegels.
I love that. Let's get into then from there, what does it mean to brace your core? And is your pelvic floor included in that bracing of the core?
Mm-hmm. That's a great question. So there's a lot of different sort of ideologies and philosophies about how to brace. I think traditional weightlifters, we think about pressure traveling outward, right? So that can of pop analogy, that can of pop is pressurized. You can't press into the sides of a can of pop when it hasn't been opened because there's pressure there. So many times we think about pushing our abdominals out to brace for a lift. And that can work really, really well for a lot of people. However, most of the time that will make pressure travel downward. So if I brace that way right now, I can feel, I'm just going to be really vulgar, that I can feel that in my butthole. I can feel pressure builds down there. And I'm really glad I don't have gas right now, because if I did, I would probably pass gas if I braced that way. For me, that tells me that I'm putting too much pressure too low, and I'm actually sending pressure downward as opposed to out. So I like to have people take a big breath in, exhale, think about kind of narrowing their abdomen, pulling belly to spine, and then brace from there and push into this sort of narrowed waist. And then I can really feel pressure travel outward as opposed to traveling downward. Does that make sense?
Yeah, of course. Yeah. It makes sense to me because I love this stuff, but I love the analogy of the the pop can and pushing outward. Where does the pelvic floor come in on this?
Great question. It should just kind of respond. So if we are just straining and closing our glottis, pelvic floor for most people, we call that a valsalva when we close the glottis and generate a lot of pressure.
Yeah.
The pelvic floor should, for most people, lengthen in response to that, meaning somebody would fart in response to that. A lot of people that valsalva over and over and over again, people will actually develop a tendency towards tightening in their pelvic floor. So it's like a guarding response. That pelvic, your body's like, oh crap, that's a lot of pressure. Better tighten up so I don't fart in the gym. That can happen over time. In a perfect world, with that brace, the pelvic floor generates a little bit of tension, but it's not rock solid. So then when you go to get up out of the bottom of the lift, say you're in a bit of, in your deadlift position, as you come up, your pelvic floor should theoretically kind of automatically contract as you come up.
Okay.
But you shouldn't have to think about it.
Yeah. Okay. So it's really just included. It's like this backup singer that's always kind of with you along for the ride.
But if they're off, it'll screw things up, right? You can tell when a backup singer is off, but when they're doing what they're supposed to do, you don't really notice them.
I love analogies so much. Now I'm going to always think about that backup singer. And if I ever hear someone with that crazy voice, I'm like, you're off key. Yeah. So we
totally, you're going to screw up the pelvic floor.
Doming. Can you talk about that? What is doming? Yeah. Is it bad? Should we not have it? Talk a little bit about that.
Yeah. Okay. So I just want to first distinguish tenting and coning from doming. Yeah. So somebody that has diastasis let's actually take a step back and talk about the abs. We've got three sort of big players in the abdominal world. We've got the rectus abdominis, that's our six-pack abs. It goes from the base of the pubic bone up to the base of the rib cage. The rectus abdominis is our two bellies, and they're held together by this linea alba, this ligament. The obliques come in from the sides, kind of the side of your body, and they wrap and they hit the sides of the rectus abdominis. Those are our twisting and side bend muscles. They help, with those two movements. They are not really a huge player in terms of deep core stability. They're a huge player when it comes to bracing, however. So they really help to give you that sort of stability when you do brace. The deepest layer is the transverse abdominis. It's the thinnest of the muscles. It's kind of the least appreciated of the muscles. It starts on the back. It wraps all the way around, kind of like a corset. that's the muscle that tends to be forgotten in a lot of powerful athletes because we get really strong everywhere else. And it's like, I don't need to strengthen that because I've got all these other big drivers, but it's also like the big key typically to pelvic floor dysfunction and injury because we forget how to utilize that muscle. Yeah. So in a diastasis, it's a separation of those bellies of the rectus abdominis. So think about like an outie belly button kind of, or like a widening where your belly button would be from top to bottom, that long line. Mm-hmm. We can see that in powerlifters. We can see that in pregnant people, in postpartum people. I'm not going to say that diastasis is not a problem, but it is normal and expected in pregnancy. This is a normal physiologic response in pregnancy so that the belly has room to accommodate a baby. Right. Coning or tenting is when tissue will protrude through that linea alba. So it's a very distinct appearance. If we were to look at somebody that's having coning or tenting, it's kind of like a sharp peak that protrudes past the muscle bellies. Okay. It's a very similar thing to doming, like the same underlying thing is what's going on. Doming can happen in somebody with or without diastasis. Doming is when we aren't engaging that deepest layer of our transverse abdominis. And it means that like our belly kind of pushes outward when we're doing a movement. So a lot of people, I will test them. I'll have them lie on their back, and you could try this at home. Lie on your back and put your hands on your tummy or hold a hand mirror and look at your abs. Lift your legs up off of the floor. Did your belly push out? If it did, that's what we would consider doming. What that tells me is that your deep core didn't turn on. So that transverse abdominis, in theory, is also an anticipatory muscle. It should really contract kind of circumferentially to control the pressure in the abdomen so that when we go to lift our legs, which is, in my case, my legs are freaking heavy, a lot of load. I have to really think about engaging my core before I do that. Otherwise, I'm going to dome. Right. So I often think of doming as just simply a sign that, like, one, it might be too much load for what you're doing, or two, your transverse abdominis just isn't turning on. So I will often have people just practice exhaling like they're blowing through a straw. So as you sit here, I also like people to put their thumbs inside their waistband and just exhale like you're blowing through a straw. You should feel like your waist narrows, that pressure between your thumbs and your waistband was kind of lessened. If that is happening, your transverse abdominis is turning on. When you do that, guess what? Nothing moves. The transverse abdominis does not move a joint. That's why it's like not a sexy muscle to train. We train it with breath. We train it with like isometric stuff like a plank, even a side plank. And it is just so key for controlling that pressure. So I like to make sure that I can keep that transverse abdominis engagement. This is my preference with anything that I do. If I can't, it tells me it's probably too much load for me. This is also coming from somebody, I had a pretty serious back injury a few years ago. And so for me, that's my metric of like, oh, you know what? You're not stable enough to do that. And typically I can keep that type of engagement with really deep lifting or really heavy lifting. I can't keep it with like, if I were to do like scissor kicks on my back, that's a very hard thing for me to maintain. So for me, it's just like, you know what? If you can't keep it, I'm going to let go of it. So I tell people, if you're symptomatic, whether it's like back pain, hip pain, or pelvic floor stuff, if you are doming, maybe it's a sign that you should try to scale back and focus on first getting that deep transverse abdominis to engage.
I relate to that so much too, because I feel it with my, like a hollow boat or leg raises or kicks or something like that. And I'm like, I feel it happening like right away. And I'm like, you guys should do this with us, like putting your hands on your hips and like blowing out that straw, and you'll feel the difference right away. And so it is some of this like breath work, or maybe you're doing some of these planks, like before maybe you get into a lift or before you get into some of those leg raises or hollow boat or something, but there's always ways to modify it as well to make it best work for you. Yeah, that's super helpful. So speaking of, diastasis, is that right? Am I saying that right? Uh-huh. Okay. Is this happening when you are pregnant? And what is also happening with your pelvic floor when you're pregnant and when you have the baby?
Yeah, great question. So one of the first hormones that starts getting produced when somebody becomes pregnant is a hormone called relaxin. And relaxin lends itself to connective tissue laxity. So this is a good thing, right? We want our skin to become more lax so that your skin can stretch out to accommodate a baby. We are also going to see laxity in all of our ligaments. So somebody will often become pregnant and they're like, oh yeah, I can do the splits now. That's because you have relaxant in your system. You don't like suddenly become more flexible or like your muscles have more stretch to them. It's that you have more ligament laxity. So all of that connective tissue is just like a little bit stretchier than it once was. We also start producing progesterone, which also has that same effect. So we've kind of got this like double whammy of tissue or of hormones that make our tissue stretchier. So that's where that diastasis comes into play, is that it's a ligament, so it's connective tissue between those two muscle bellies in the rectus abdominis. It can become a little bit stretched out. We can see that persist in the postpartum period for a couple of reasons. One is that you had those two hormones in your system for 9 months, right? So it's not like, oh, they're gone, everything bounces right back. That's piece number one. Piece number two is that if you're breastfeeding, your body's producing a ton of prolactin, and prolactin inhibits the production of estradiol. Estradiol is one of our biggest androgens as women. So it is what really lends itself to like tension of connective tissue. So we kind of can see like women in this postpartum period being like, oh my gosh, I've done everything I need to close my diastasis, and they're still breastfeeding. And I'm like, just wait. It might go away like that. And for many people it does.
Okay.
That's not always the case, but just knowing that like, okay, while I'm still breastfeeding, especially while I'm breastfeeding and my menses isn't back, I'm probably going to have more ligament laxity. And we also know that like some people at baseline just have more of that laxity than other people, right? We all know those like party trick type people that can like, put a leg behind their head and they have just more tissue elasticity. They're more what we would call hypermobile at baseline. Those are the folks that are probably really going to experience more difficulty closing their diastasis because they have more give of those tissues at baseline. So in answer to your question, what happens to the pelvic floor? Because we have more give of those ligaments and because the abdomen starts to increase in volume, well, guess what? The pelvic floor sometimes gets tight because it's trying to now hold up extra weight, trying to stabilize a pelvis that's really a little bit more unstable. So a lot of people will say, oh my gosh, I really need to start doing my Kegels. I got pregnant. It's like, no, probably not. Your pelvic floor may actually be on the tighter side now because it's got more work than it has to do. Well, and then at the end of the day, what does the pelvic floor need to be able to do at the end of those 40 weeks? It needs to be able to stretch more than it's ever stretched in its entire life. So I love seeing people in the pregnant or in that antepartum period when they're pregnant to teach them how to relax their pelvic floor, because ultimately birth is the number one experience of pelvic floor lengthening and stretching.
So interesting. There's so much. What a female's body can do is just incredible, right? Isn't it so cool when you think about it like that? So great. So pelvic floor changes a lot during pregnancy, postpartum. What about through perimenopause and menopause?
Yeah, great question. So as I mentioned with breastfeeding, estradiol is really, really important for us to be able to produce plenty of lubrication and to maintain muscle mass. Unfortunately, when we stop ovulating and we start going through perimenopause, estradiol, which is one of our estrogens, like starts to drop. And it will kind of in perimenopause, we'll see surges and then dips and surges and dips. And once you're postmenopausal, estrogen is really quite low. What we see in women in that age is typically muscle atrophy in the pelvic floor. And potentially dryness. So a lot of those women are going to have like pain with intercourse because they're not able to produce any lubrication. So that's somebody that really would benefit from either using a lubricant or in some cases talking to their OBGYN and making sure that they have like, maybe it's a topical estrogen cream to use on their tissues to kind of promote more lubrication. These are also really important women to maintain strength of their core and their hip muscles and their upper back muscles, because we can kind of see like this slumping forward. If you like, you lose muscle mass everywhere, unfortunately, after menopause, unless you work to maintain it. Well, if we're weak in our upper backs, we're weak in our glutes, we're going to have postural changes and pressure is going to travel downward. And then we can actually see more symptoms of pelvic floor stuff crop up in that postpartum periods, or excuse me, postmenopausal period. So a lot of women will come in and they'll be like, I was fine. And then I went through menopause and now I have incontinence and now I have painless sex, or now I have pelvic organ prolapse, which is where one of your organs like your bladder, bowel, or uterus sits a little bit lower in your vaginal canal. So those are all things that we can see. So again, it's really important. I think that the most, if I could encourage any of your listeners to do anything, it's just to maintain strength in your body. Not specifically.
Did you guys hear that? Did you hear that? This is what I preach, I feel like, every day. And we have a whole podcast on menopause. I had Dr. Mary LaCoux, and it was incredible because honestly, the base of so much of what I do as a coach and women's health in general is strength training. And like the stronger we are, the more everything will feel balanced in the long term. And as our body's changing, the earlier you can start and the more you can keep going and stay consistent with it, like it's going to be easier to age. I mean, of course it's not easy, but it makes it easier when you're stronger. Everything's easier when you're stronger, I guess. Right.
Totally does. And that's also true for, I have so many women come to me say like, I think I want to get pregnant. What should I do? And I'm like, okay, we're going to get you going on a hip thrust program, or, you know what I mean? Like we got to work on your deadlift. And they're like, how is that going to help? I'm like, it's going to help your pelvic floor. If you have a really good hinge pattern and you're super strong through your hamstrings and your glutes, you're going to do better in your pregnancy, which sounds crazy. I mean, that's the number one piece of advice I give anybody when they're like, what should I do before I get pregnant? Get in shape.
Lift heavy shit. That's what we want them to do. Oh, I love that so much. This has been so helpful. I feel like we could talk about this for like hours. I have so many more questions. What do you feel like would be something that we can just leave a little tidbit on pelvic floor health for women specifically? Because that's mostly what this audience is. Like, what is like maybe a couple more tips we can give them just to understand their pelvic floor a little bit more?
Yeah, I think that finding your connection to breath is the most important thing for people. So if you were wherever you are right now, if you're sitting, tune into like, where does your pelvis, where is it? Can you feel between your sits bones? So I like to think of kind of like this 4-pointed rocker system. So side to side, we've got each of our sit bones. Forward and back, we've got our pubic bone. So maybe you rock forward and back. Can we visualize almost like a diamond shape between those 4 points? And then as I take a big breath in, not into my chest, but into my belly, can I feel that tissue between those 4 points soften and lengthen? That's how you relax your pelvic floor. Then as you exhale and draw your navel to your spine, can you feel not that your vaginal tissue squeezes, but can you feel that the tissue between those 4 points lifts ever so slightly? That's how we find the appropriate coordination of our pelvic floor. So we're not thinking like big, strong Kegel and squeeze, but we're finding, wow, when I exhale and generate that nice deep core contraction, there's a little bit of activity in my pelvic floor. Not a ton. And again, it's the backup singer. It's not the first thing. We don't start with the pelvic floor, but we feel, oh, it does a little something. It's supporting. And then when I inhale, can I feel it let go? Doing this with some regularity is so, so helpful for everybody. It's going to build that mind-body connection. It's going to ensure that that muscle is moving through its range of motion. So it's not just holding tight and it's not just staying loose. It's being able to go from each side of the spectrum to contracted to relax. And with time, the beautiful thing is that if you can connect to breath, your pelvic floor is just going to follow suit and you're not going to have to think about it. So I think that would be the best tidbit that I can give everybody. And the other piece of advice would simply be that if you're dealing with symptoms, it's not normal. You can find somebody to help with this stuff.
I love that so much. I do ask this question to everyone that comes on. I know we talked mostly about pelvic floor, but I know you're a fitness buff and I know you love strength training. So what is one thing you wish you knew before you started your fitness and wellness journey?
That the rules also apply to me. And what I mean by that is I would never tell a client that they should train every single day. But in my mind, I'm like, well, those rules don't apply to me. I can train every single day. Overtraining doesn't apply to me. I can overtrain. The rules, we are all humans with the same physiology. If there is a general guideline out there, you're not stronger or better than those rules of physiology. The rules apply to you. You're human.
Are you sticking with that one right now?
I am right now. Yeah.
Okay, good.
I took a
I'm
rest day
rest
yesterday.
Okay. What'd you do?
I took a rest day yesterday.
Good. Thursday, Sundays are my rest days every week, no matter what. People are like, oh, you don't work out every day. I'm like, no, 100% not. So
wish I could have just bought into that sooner.
That's for you. At least you do now. That's great.
It's true.
Where can people find you online and get more information from you?
Yeah, my Instagram page is Dr. Amy Osborne, and my clinic is Apto Physical Therapy, APTO. I do offer some virtual services, and would be happy to like chat through anything and be of support, or at least help point people in the right direction if they do need to find a pelvic PT, because like I said, this is like my life's work, helping people not deal with this stuff. And I'm just so glad that I got to be here and spread the word so that people know what's not normal and what as women we don't have to live with.
Yes. Oh, I love it. Thank you so much for being here. Such a wealth of knowledge. I love talking to you, and I learn so much every time I do. So thank you so much for being here. I appreciate you very much.
Thanks so much for having me, Tara.
Thanks for coming to this Tara Talk. I hope you're taking something away from this episode, and if so, I would love to hear about it. You can connect with me at The Tara Talk and at Tara LaFerrara on Instagram. A few ways you can help support the show and help spread the word. You can share it on Instagram, tag at The Tara Talk and at Tara LaFerrara. Send an episode to a friend, and please leave a review if the show is resonating with you. It takes just a few minutes, and it means so much to help this show grow, and it helps me to continue to bring on badass guests for all of us to learn and grow from. I am so happy you're here and excited to be on this journey with you. Until next time, be a badass with a good ass.